Well, dry eye can be uncomfortable, but there are treatments to help sufferers deal with the condition. Optometrist Dr. James Tuttle from Wheatlyn EyeCare is here to answer the most asked questions about dry eye. I guess first and foremost, how common is this?
It's very common. There's more than 23 million Americans that suffer from dry eye.
Wow.
And as it's increasing over time, we're finding out there's different types of dry eye, and the type of dry eye determines the treatment.
Okay, so what types of dry eye are there?
Well, the major types are aqueous deficiency, and that's where there's actually a low volume of tears, or production of tears. Then there's also evaporative disease, and evaporative is where tears tend to evaporate too quickly due to chemical changes with the tears over time.
Okay.
And also with dysfunction of the meibomian glands, which are the vertical glands that run, the glands that run vertically inside the eyelids that secrete the portion of the tears which are there to prevent the tears from evaporating.
So how do you figure out who has what?
Well,
is it based on their symptoms?
There's different tests that are done. Oh, also there's dry eye due to systemic disease. People that have rheumatoid arthritis, Sjogren's, diabetes, glaucoma. The different tests are done to determine which types of dry eyes, and then the tests that we do in the office, first we take an extensive history, and the history determines what type of visual demands they have, what type of medications they're taking, the symptoms, when they're the onset of the symptoms, the severity of the symptoms, the duration of the symptoms, and whether they're use CPAP machines, which are more common at night, ceiling fans, sleeping in an area with ceiling fans, working in a dry environment.
I know there's one test, I call it the I've suffered for the past 10 years with dry eye, and one of the tests, I call it the torture stick. When you stick like the little...
the Schirmer?
Yes. To see how much moisture your eyes produce in a certain amount of time, and it can be not so fun.
Yes.
But it is a good way to determine exactly how dry they are.
Yeah, we need to determine what the volume of the tears,
and
that's what the Schirmer test is.
Yeah.
You need to determine how quickly the tears break up, or how quickly they evaporate. That's the tear film breakup test.
So is it a good idea to go to the store and try the over-the-counter stuff first before seeing a doctor? Or
some of that works for the aqueous deficiency. Some over-the-counter tears will work. Most people don't use them to the extent that they need to.
Right.
Their eyes bother them, so they put a drop of tears in their eyes, and that hardly lasts. And they do it for a little while, and then it doesn't seem to work.
So it's always best.
So they assume it doesn't work, but maybe they're not using it consistently enough. But for the aqueous deficiency, a lot of times normal over-the-counter tears will work, but. As that worsens, you need other things like Restasis and
there are options out there. So always best to contact your eye doctor then if you're suffering.
Yes.
Thank you so much for joining us.
You're welcome.
We appreciate it.
Thanks for having me.
Jeff, over to you.